Right, James. So following on from the assessment, we're now kind of 2 months down the line following the injury to the ankle. So we're still experiencing a little bit of pain, and a little bit of stiffness when we're walking.
Yeah.
And it feels as though you kind of,
Just,
you're catching it as you're walking, maybe?
yeah, it just doesn't feel like it's moving as freely as obviously my uninjured side, my right side.
Well, obviously following my initial assessment of your ankle, there's a technique that I want to look at doing, but before that we need to kind of rule out any contraindications. And looking at your subjective history on the paperwork, you have slight balance issues. Is that right?
Yeah, it's not.
How long have
steady on
them been going on for?
Quite long actually.
Yeah.
Well, I've never been the steadiest on my feet.
Right. So I'll just quickly, briefly
so
go
now,
over what's going to happen. Well, I want you to stand up and put your foot forward, and I want to do this kind of motion. Yeah. So I'm aware that we'll probably have to modify the kind of environment to suit. Okay. But to kind of, for me to get a grasp of how that is, if you like to stand up, take hold of my hands, I'll just do a little test. Okay, you okay there? You're not leaning against it?
No.
That's it, right. So I'm going to be here. When I take my hands off you, all I'm going to do is I'm going to put them up here, but not touching. Okay? So if you go backwards, you'll just fall into my hands. Okay? But when I take my hands off you, I just want you to look at me, and then when I say close your eyes, I just want you to close your eyes. Okay? So just close your eyes now. Yeah, that's fine. Yeah, just have a seat. So yeah, there's a little bit of an issue there, that's fine, but we can still do what I had in mind. We'll just have to modify the environment, okay? So if you would like to pop your socks and shoes up, and it was your left, it's your left hand.
Yeah.
We're just going to pop this bed down. So just while you're sitting there, I'm just going to place a chair this side and a chair this side. And basically all I'm going to ask you to do is when you're standing up, this is face that way, okay? Just take hold of the chairs for support. Just move a little bit closer into the table. That's it. That'll do that. That's grand. Are you okay there?
Yeah.
Right. So basically all I want you to do is that motion, what I said, but we're going to put our foot on the plinth. Okay? That's exactly where I want you. So what I'm going to do, I'm just going to offer some support here. Okay? I'm going to put a strap around the bottom bit of your leg. Okay? And then when I move back, I want you to kind of lean forward, because that's where you're getting the problems from there. Yeah?
Yeah.
So hopefully this is going to show the bottom part of your leg and the top part of your foot here the correct movement to move, okay?
Yeah.
That sound okay? Drop that down a little bit. Up to that. This pillow, this towel behind, just to stop any friction on your hands as well. You okay there?
Yeah.
I'm just going to take up the slack. So I'll put some pressure on. So just slowly lean forward. And back. Does that feel okay?
Yeah.
And forward. And how does that feel compared to normal?
Yeah.
And we're going to do one more. And just relax there. That's good. That feel okay?
Yeah, fine.
Yeah.
Yeah, sure.